Yo guys, how's it going? In this video I want to tell you why you should be doing traction and why you should get started soon, as well as why you might not have to do it as much as you think you do, and also when you should do it. So first of all, a lot of you guys might not know that traction actually has been shown to reduce penile pain as well as the hinging effect. It's also been shown to lengthen your flaccid penis, okay? And this is one kind of reason why I think you should be doing traction separate from everything else. If you can just lengthen your flaccid penis and become kind of a shower rather than a grower, that alone will prevent the disease from worsening, and it's seriously important. So again, traction has been shown to reduce penile pain and hinging. It's also been shown to reduce the curvature, of course, lengthen your erect penis as well, and also reduce the actual size of the scars of the fibrosis. It reduces fibrosis also on a molecular level by lowering TGF-beta and changing the ratio of a bunch of different things that are important for preventing fibrosis. But I want to focus on this flaccid lengthening aspect of traction. So the thing about traction is when the studies that we have on traction show guys using these devices, right, for on average about 6 hours a day, and that is a really long time. Sometimes it goes up to 8 or 9 hours a day in these studies, and the results are very profound. It's very effective. Traction has been proven to be very effective. I think in one study it showed even that like 40% of men who were good candidates for surgery no longer needed surgery because of traction. So traction is to be taken very, very seriously. But aside from simply straightening your penis, what's very important is that we get the blood moving through your penis and get the kind of hematoma to go away and stop the disease from worsening. So a long time ago, when maybe almost 10 years ago now, when I first had really bad symptoms, I remember I really dreaded going to school or work because sitting would cause so much pain. I'd have hinging, I'd have pain and inflammation in my penis, and I'd have to get up and stand up and sometimes just crouch down, and really it was a terrible time. I was very miserable. But naturally I kind of started stretching my penis just kind of naturally in the morning before going to work or school. And by doing that, my flaccid penis would hang longer and fuller, and it wouldn't kind of buckle up like that. And then the blood would flow through there, and I wouldn't have pain while sitting, and I wouldn't have worsening while sitting. And this was very important for my recovery, because if your penis isn't getting worse, it's not going to, if it's not getting worse through sitting, especially, it's probably in a good state. I think when you're sitting and it's buckling up and bending, there's certain parts of your penis that are not getting blood, and they're not able to heal properly. There's inflammation in there, and the blood's not moving through there well. So you really want to lengthen. You want to do a stretching even for a little bit. It doesn't have to be for hours, but if it's before you sit, just for a couple minutes by hand, that might really help you out. And you want to really consider this lengthening your flaccid penis to be kind of the goal of traction, one of the goals of traction. I mean, personally, I think you should be stretching your penis as long as possible, for hours if possible, but I know that's often not feasible, especially by hand, but that doesn't mean you shouldn't do traction for a little bit. So you do want to think, okay, I want to lengthen my flaccid penis. And you don't necessarily need to lengthen your flaccid penis, though. I would say you just want to get your flaccid penis to hang at its maximum length more often. So when I first started doing traction, or when I first got Peyronies, my penis was a lot shorter. My flaccid penis just always appeared shorter, and it was very bent. It was hard to even pee. It was very painful. I couldn't even pee straight. And then once I started doing traction, I remember looking down and seeing my penis very full, hanging very long. My flaccid penis nearly doubled in length. And I mean, that might not be true, but it certainly looks that way. My penis always hangs at its fullest length now, and it hangs very full, and I have no pain and almost no deformity whatsoever. But ever since high school or when I was pretty young, I always had kind of hard flaccid, I think. And when I first started traction, I remember I would have to stretch my penis slowly out to full, and it felt very kind of scary. And slowly from zero to full stretch, Whereas now, my penis just always hangs at full length, and I just put tension on it now, and put tension. I don't have to like stretch it out like that. And I think just making it so my penis hangs fully all the time, that truly prevented my Peyronies from worsening. And I remember really being happy about it. And I achieved this relatively quickly, doing traction for just a couple of minutes, again, in the morning before going to school or work. And again, I remember peeing straight, looking down, and thinking, wow, this is so much better. This is really important. The fact that I can pee straight without pain, I can go to work, and things are hanging a little bit better, something is working. So from there, that's when I started doing traction a lot longer, 30 minutes, hour, 2 hours a day, and really got into it. But I don't think that you need to do it that long. I think you just need to get to a point where your flaccid penis is really used to being stretched out. So this leads me to another point, which is that traction by hand might actually help your penis learn to do that more than with a device. Now, I could be wrong on this, but just my kind of sense of it and through my experience, I get a much better result from traction by hand than if I get better results if I do traction by hand in a more dynamic way than if I just stretch my penis out to one length at one tension and leave it there like a static stretch, similar to the kind of stretch you would get from a device. That is effective, and that is great. The studies prove it. But the thing about traction by hand is you are forced to reinitiate the stretch because your grip will loosen. So if you're pulling overhand grip, you're stretching it for a little while, and then you have to start over because your grip loosens. You might even change your grip to upside down grip, which is also beneficial. And that puts a different kind of stretch on your penis. And then you might change hands because your hands get tired. Well, what this does is it forces you to keep on reinitiating the stretch from zero, wherever you're at, to full stretch over and over and over. So if you sit down and watch a movie and you're like, okay, I'm going to do traction through this entire movie, you might be reinitiating the stretch and changing the angle every few minutes throughout the entire movie. And that alone actually, I think, has more benefits than just a static stretch because you're teaching your penile tissue to lengthen. It's kind of like, this might not be a good comparison, but if you wanted to stretch your hamstrings and get looser hamstrings, you wouldn't just stretch you wouldn't stretch out your leg to just one degree and just leave it there. You would certainly go up and down, different angles and things like that, and it would be more dynamic. But when I say traction by hand is dynamic, I don't mean that I'm stretching my penis all around and helicopters and things like this. You can do that, but I really see it as more of a subtle thing, where it's just every time I re-grip my penis, I just put a little bit different kind of angle on it, just a little bit. It's really intuitive. But again, we don't have any studies on traction by hand, so I can't prove anything here. But there are a lot of guys who do agree with me on this now, that traction by hand does seem to have benefits over traction with a device. You really have control over what you're stretching, what parts of the penis you're stretching. And it's possible, in my opinion, that the reinitiation of the stretch because of your grip loosening is beneficial to every aspect of traction, but also to this lengthening of the flaccid penis. When I really do think I had hard flaccid all my life, probably. And I remember seeing other guys in the locker room or seeing a guy's penis in this documentary I saw a long time ago. And I remember seeing like, wow, like my penis does not hang like that. That looks very elastic and rubbery and somehow healthier. I didn't really understand it when I was younger, but I remember seeing this documentary though. I remember really knowing like, wow, okay, my penis should be like that. Something's wrong. But once I started doing traction by hand, when I started seeing these benefits while I was peeing or just going about my day, my penis started to change and look more elastic, more like the penises I had seen. And I realized then, like, I have to keep doing this. This is working. And the more I did it, the more benefits I got. And as my flaccid penis lengthened and started to hang better, my inflammation just went away. I just stopped having inflammatory episodes. And, traction has reduced my curve, reduced my scarring, made my erect penis straighter, smoothed out my curve completely. And That reminds me, I had a new curve, a new indentation that was like 6 years ago. And because I started traction on that right away, because I've experienced this, I've had Peyronies for over 10 years now, because I knew that I should start traction by hand right away. I started doing it at the times that counted. I started doing it in the morning. I started doing it after sex. I started really stretching my penis gently by hand. I was able to get rid of that new curve, that new indentation, within a couple weeks. Maybe not completely within a couple weeks, but it's gone now completely. But after a couple months, I mean, yeah, that was just gone. It's really important to do traction early on. And again, it's not necessarily about tension. It's really about opening up the damaged area of the penis and letting it kind of breathe. So, I wish we had studies on, the different tensions on traction and how effective they are. I wish we had studies on traction by hand versus traction with a device, but we do not, and we never will, honestly, and that's okay. But I guess what I want you to take away from this video is that you do want to start traction right away. Just because you can't do it for 6 hours doesn't mean you shouldn't do it. You want to start it right away, and also consider the fact that traction has been shown to reduce penile pain. Also consider the fact that it has been shown to reduce hinging, and focus on just the goal of lengthening your flaccid penis. But more accurately, I would say you're trying to lengthen your default flaccid kind of length. So it might not actually get, even if it doesn't get longer, your maximum stretch, your penis is just going to start staying fully stretched out on a regular basis, and it will feel so much better to you. Now, guys, always be careful, okay? You could always injure yourself with any kind of penile manipulation. Keep that in mind. But in general, I just want to encourage you to do it and not to dabble in it, because I really wish I would. If I could start over, I think, I think I could avoid having Peyronies to begin with. I really wish I could start over and do traction right from the beginning and do it right, because now I know what to do. So anyway, if you have any questions, do let me know. And thank you so much for watching, guys. I really appreciate it. And take care, okay? See ya.